Hello and welcome everyone. My name's Kirsty. I'm one of the chemotherapy sisters on the second floor where you'll be getting your treatment. And the purpose of this session is really to explain about some general side effects of chemotherapy, the process of you actually getting your treatment on the second floor, and also to introduce you to the support and information service. People sometimes worry about some of the terminology that people use, the words and phrases about their treatment and blood tests and things. But we're here to just explain things, and there are no secrets. So just ask us if there's anything you're not sure about.
So the chemotherapy pathways are complicated. They're certainly complicated by the individual treatments that we give patients, which they are quite literally individual to that patient. They're also complicated because of the number of different tests and clinical reviews that you need to have before you have chemotherapy to ensure that what you're having is safe and that you're tolerating the treatment. And this chemotherapy education session is to try and break down that barrier a little bit and explain what these steps are that patients have to go through, and also how they can help themselves to ensure that you get your chemotherapy on time and safely. When patients know what to expect, they can manage their side effects much better. They know who to contact if they need support, and also they feel empowered to be able to take some control over a very difficult part of their life.
So we treat about 70 people a day on the second floor, and we're open from 8 o'clock in the morning to 8 o'clock at night. Nowadays, most people get their treatment as an outpatient, and that's because we've improved a lot of the side effects that people used to have, which means that you can come and go the same day and come back for your treatment the next time. Your treatment will be planned by the multidisciplinary team. So that's a big group of staff who work out, based on your blood results and your scans, what the best treatment is for you. You're one of the consultants or a specialist registrar. They will be giving you some information leaflets about the treatment you're going to be having, and then you'll be able to look through those before you sign your consent form, which is important to sign before you actually come and start your treatment with us. You'll also see a pharmacist before you start your treatment. They work with the chemotherapy nurses to sort out your prescription for your treatment. They'll want to go through all the normal medicines you're on, and if you've got any allergies to anything. Some people are keen to take supplements. We want you to check with the pharmacist first, because we know that some supplements can interact with the way the chemotherapy works. So when you come and see the doctors, either on the first floor or the fourth floor, please make sure you see the pharmacist. The other people you might also see, and hopefully you've already met, as the clinical nurse specialist. Sometimes they're known as a key worker, and they're really there for you for your support from when you get diagnosed, throughout your treatment, and after that for follow-ups. If you don't know that person's name yet, please ask us and we can find out for you. The other people you might meet are research nurses and practitioners if you happen to be on a trial, and there are some support workers in the clinic who help you with administrative things about your clinic appointments. Also, some of you might be having surgery or radiotherapy, so you might see people from those teams. So there are lots and lots of different types of treatment, and they're all given in slightly different ways and in different combinations. It may be once a week, once every 2 weeks, or once every 3 weeks, and it may be one drug, or it might be 2 or 3. Most treatments take about 3 hours, but it just depends as to what treatment you're having, as to how long that'll take. Chemotherapy works right the way through your body to get to the cells that it needs to. It will also mean that it will affect the healthy cells for a few days at a certain point, depending on how often you're having your treatment. Some people are having drugs called immunotherapy treatments and antibody treatments. They're not chemotherapy treatments, but they are given by us on the second floor. So they're being more commonly used nowadays, and sometimes they're used on their own or part of a trial. So it may be something that's relevant to you or not. Most people will be having their treatment through a drip in their arm. Some of you may have had a little cannula before, so essentially we put a little needle into your arm and we take the needle out and leave a little plastic tube in your arm, and that plastic tube just stays in while you're having your treatment for those few hours, and then at the end we take the drip out and pop a plaster on. You may also have chemotherapy as a tablet or as an injection, so an injection into your fat called a subcutaneous injection, which might be given into your tummy or to your thigh. The other way that people may have their treatment is through a long line that goes into a big vein into your heart. So that's either a PICC line, which goes into your upper arm, or a portocath, which sits in your chest. So the idea with those lines is it means that you can go home with your chemotherapy, which may be a bottle that goes over several days. The other reason that sometimes people have a line that stays in is because your veins might be very tiny and the drugs we're giving are harsh on the veins. So for some people we can only use one arm because of surgery they've had, and Your safety is our priority, so sometimes we recommend a line that stays in. This is our floor at the start of the day. A few people will be having their treatment on a bed if you're having a very long treatment or if you've got problems with mobility. But most people are having treatment in a reclinable chair. Above each chair there's a TV screen that's got radio, TV and Wi-Fi access. And if you could bring any earphones that you may have, that would be helpful. Sometimes after a few treatments, if people are well, they choose to have their treatment in that middle space.
This building, from its inception, there was a lot of involvement from patients and nurses to try and create a really positive treatment environment. It's nice and bright and light. It's a lovely, open, friendly environment to receive your chemotherapy. You're more than welcome to bring somebody in to keep you company for the day. There's tea and coffee rounds, sandwiches or hot lunch provided. But there's also a plethora of shops out on Tottenham Court Road. You can bring things in with you if you like.
Most people nowadays will be having treatment a different day to the day that you come to clinic to see the doctor. So for example, if you went to clinic on a Wednesday, you might come for your treatment on a Friday. The chemotherapy drugs are made for you and they take about an hour and a half to be made in our production unit. So we find that coming for treatment a different day works much better. This means that when you come for your treatment, we should have your chemotherapy drugs and your prescription ready to get started.
There can be delays in your treatment. The most common delays can be if you haven't been to clinic. Patients must have a blood test before every treatment. They must see the doctor before every treatment because we need to know, one, that they're coping okay with what we're giving them. We need to know their blood counts have recovered from the previous cycle of chemo they've had.
Chemotherapy generally will adversely affect your blood results, so it will make your immune system lower. It can affect your kidneys and it can affect your liver function tests as well. That in itself is not a problem as long as we monitor it and we manage any potential side effects that we can see with it.
Some people may be having treatment the same day that they see the doctor, if they're seeing the doctor in the morning, but you would need to have your blood test done a couple of days before so that there'll be time to give you your treatment on the day. So when you come in for your chemotherapy treatment, you come into the building on the ground floor. There are two lifts. One is called the house lift and one is called the garden lift. If you take the house lift, you'll come straight out on the second floor in front of the chemotherapy reception, and that's where you need to sign in with the person who's behind the reception desk. That person will give you a name band and arrive you on our computer system. Reception should be able to let you know right away if there are any delays for any reason, but we hope to see you within about half an hour of your appointment time. But if it's got beyond that time and you're not sure what's happening, please ask someone so that they can find out what's going on for you.
My name's Rebecca. I'm just going to take you through to the cannulation.
Someone will bring you through to an area to recheck your height and weight. It may have been done before, but we like to do that again on the day that you first start treatment because it's an important safety thing and we can make any changes then if there are any that need to be made. We'll then take you to a chair so we can check your blood pressure and things so we know what's normal for you before you start your treatment, and put the drip into your arm or dress your line if you've got a PICC line or access your port. And then you'll be having a seat back in that middle area whilst waiting for your treatment to be ready. As soon as there's a chair free and a nurse available and your treatment's nearly ready, we'll call you through.